Good morning. Happy Friday. Weekend's almost here. Whatever that means, I'm not sure. But when someone figures it out, I'm sure they'll tell me. Let's talk about where we are today in terms of the data. Total hospitalizations ticked down again. That is good news. Just a tick, but we'll take it. It's better than going up. Again, this is one day, but it is flattening, reducing slightly, depending on your point of view. This is sort of a test. Are you an optimist or are you a pessimist? Pessimist would say we're basically flat. Optimist would say, I think we're starting to trend down. So it's a personality test. Net change in total hospitalizations is undeniably on the decline. The 3-day average, which is more accurate than any one-day number, also says the same thing. The ICU admissions is down. That's not that telling to me because, as I said, the entire hospital is now basically an ICU ward. But the number of intubations is down, and that is very good news because intubations 80% of the time wind up in a person not recovering. So that's really good news. The reality and the counter-narrative, counter-fact, number of new cases that walked in the door, COVID cases, walked in the door of a hospital, is still about 2,000 per day. And that is still very high. So that, yes, fewer people in the hospital, fewer people being intubated, but still 2,000 people walking in the door. And if you notice, it's hovered about the same rate for several weeks. It peaked, but 2,000, that's a very high number. Number of deaths, unfortunately, refuses to come down dramatically. 630, that is still breathtaking in its pain and grief and tragedy. And basically flat again, like many of the other numbers. Just in terms of overall context, where are we? Where are we going? Everybody wants to ask that question every day, and I understand that. We have to get to tomorrow. What is the final conclusion of this ugly chapter? I still believe it's when we have a vaccine, when people know that this virus is totally controlled. That's 12 to 18 months. Hopefully it can be sooner. Maybe there's a medical treatment in between. We hope, we pray. A lot of medical companies are working very hard on it, right here in this state and all across the country. That would totally change the trajectory. People who are looking for a quick fix, a quick answer, it would be a medical treatment. That would be the quick fix. Announcement of a vaccine, that would be a quick fix. In the meantime, it's going to be an incremental process between today and tomorrow. As much as people don't want to hear that, that's the truth. You're not going to hear any day soon, it's over, the nightmare ends, and we wake up. It's going to be incremental, and we have to be smart as we do this. Do no harm, control the rate of infection as we go through this. We also have a lot of work to do operationally in terms of the healthcare system and now testing, which I'll talk about in a minute. The testing tracing is the guideposts through this, right? As we're working our way over the next several months, the testing, which is informing us as to who can go back to work, helping us isolate people, it's about testing. And testing is a totally new challenge. Nobody has done this on what we need to do on testing. And then phasing the ramp up of the economy to the new normal as we do this. Again, in terms of perspective, I think of it this way. Our whole response thus far basically has been a response to a crisis, right? And as the numbers start to come down and as people start to take a deep breath and people start to feel we can control the beast, which we can, and they take comfort in the fact that we can control the beast, which I do. I was afraid this thing was uncontrollable, and that despite everything we did, the numbers were going to continue to go through the roof. And by the way, nobody could tell you otherwise. But we proved we can control the beast. We can reduce the rate of infection. We did that by our response to the crisis. Credit to all New Yorkers, all Americans. They flattened the curve. Nobody else, no government agency, no public health expert. People's actions flattened the curve. We responded to the crisis. That's sort of all in this first response, the first phase. Bring down that infection rate. The infection rate was one person infected 1.4 other people. That's when an epidemic breaks out. That's fire through dry grass, right? That's what we talked about yesterday. We have the infection rate down to 0.9. One person infects 0.9 other people. I've never met a 0.9 person, but the infection rate is less than 1 to 1. That then sees the outbreak starting to subside, the numbers starting to come down, which is what we're seeing in the numbers. So we did that. This is all in our response to the crisis. And let's say it's from minute 1 to where we are today. This has all been crisis response. Bring down the infection rate. We did that. Bring up the hospital system to this projection level, which would have been impossible, but ramp up that hospital system so when you have all these new infected people, you can handle it. You don't overwhelm the public health system. You don't have people dying in hallways, which is what we saw in Italy on TV, right? That's all phase 1. That's critical response. Hurry up, get it done. Every day is vital. Drastic measures taken quickly in a coordinated way. That's phase 1. We're still in that phase because you still have 2,000 people coming in the door every day. So don't get cocky, don't get arrogant. We're in control. No, you're not in crisis because you can control the beast, but you're only controlling the beast because of what you're doing. That's where we are. We're starting to transition to another place. What's the other place? It's going to be the second half of this situation, which is unpausing, right? The situation we're in now is unsustainable. People can't stay in their homes for this length of time. They can't stay out of work. You can't keep the economy closed forever. You just can't. Society can't handle it, personally or economically. So now we're moving into another phase, which is this reopening phase. How do you plan the reopening? Nobody's ever done this before. And how do you plan a reopening of an economy and at the same time be cognizant of the public health crisis that you're still in, right? We have the infection rate down to 0.9. One person is infecting 0.9%, less than a person. Okay, the epidemic outbreak percentage is 1.2. One person infecting 1.2. You only have between 0.9 and 1.2 is a margin of error. We have to reopen, we have to reopen, we have to reopen. Yeah, you only have a very slim margin to operate on. You open too fast, you bring people out too fast, you'll get to 1.2 in 3 days and we'll be right back to where we started. So that's the I want to get out of my house versus public health balance that we're talking about. How do you measure this? How do you calibrate it? You have to develop a testing capacity that does not now exist. And then you test people on a higher volume than ever before. You then trace them to find other positives, and then you isolate them. In the meantime, we have to stabilize the state's finances because we have a terrible economic deficit. We're spending money every day that we've never dreamed of spending. We're asking all these hospitals to do things, all these local governments to do things. We're paying. And we're paying when we're in a position where we don't have any money, which is also an unsustainable position in life. You can't keep writing checks if you have no balance in your account. It doesn't work long term. At one point they come and they knock on the door. I don't know who knocks on the door when you're a state government, but somebody's going to come knock on the door. So that's where we are overall. The next frontier is going to be testing. We don't have a testing system that can do this volume or that can be ramped up to do this volume. We don't have a public health testing system, by the way. It's de minimis. If you look at what our government departments of health have, it's a relatively de minimis capacity. Well, what's our private sector testing capacity? That's relatively de minimis also. Think about what we're talking about. We're talking about labs that normally operate to do blood testing. If you need a marriage license, you have to get blood. If your child is sick, they send them for a strep test. The doctor says, go take a blood test for allergies. You go to a lab to have blood drawn. That's basically the system we're talking about. That system does not do large-scale COVID testing. This COVID testing, first, in and of itself, is a very complicated new test. It's not as simple as drawing blood and getting it tested. This test, in and of itself, is complicated and expensive. And you don't have the network that does that. It does not exist. This is where we were with the hospitals. We came up with what we call surge and flex. What happened with the hospitals when this started, we started seeing these much higher numbers that would overwhelm our hospital system. Well, how do we ramp up the hospital system? You don't really have a public hospital system. Downstate New York, you have about 100 hospitals. You only have about 15 of those 100 are public hospitals. The rest are all private hospitals, voluntary hospitals, but they're all private hospitals. We had to get those private hospitals to work with government in a coordinated way. Never happened before. Extraordinarily difficult. We did it, but it was a phenomenal undertaking. You now have 300 laboratories and hospitals across the state that do virology testing. How do we get 300 private labs and hospitals to become one system statewide to do testing for COVID? And how do we get them all coordinated? This is something that has never been done before and is going to be a tremendous undertaking. Also, to further complicate it, what they will tell you now, because we've been having the conversations, the labs, if they can get the test, which they have to purchase from private sector companies, the tests require certain chemical reagents to operate. So you take a sample and then you mix it with other chemicals. They can't get the chemicals that they need to mix to do the test. Well, who has the chemicals? No one has the chemicals because everybody has been overrun with demand, and the chemicals come out of where? China, where everything has come from over the past 40 days. Everything goes back to China. And China is now in a position where they're being asked globally for these reagent chemicals. And that is a piece of the equation that I can't figure out. And that's why the federal government has to be part of this approach and part of this answer. I can do what I can do on the state side, and I will. And I'm going to issue an executive order that says the Department of Health will be coordinating those private sector labs, which are private sector companies, but they're licensed by the state of New York. They're permitted by the state of New York. And we need them to step up and work together. But the federal government cannot wipe their hands of this and say, oh, the states are responsible for testing. We cannot do it. We cannot do it without federal help. I'm willing to do what I can do and more, but I'm telling you, I don't do China relations, I don't do international supply chain, and that's where the federal government can help. Also remember, the federal government at the same time is developing testing capacity. So we wind up in this bizarre situation that we were in last time, 50 states all competing for these precious resources. In this case, it's testing, and then the federal government comes in and says to those companies, I want to buy the tests also. This is mayhem. We need a coordinated approach between the federal government and the states. Second thing that is of immediate concern is we have to stabilize the finances of the state. The federal government has passed 3 bills to address this crisis. Of those 3 bills, the state governments have gotten precisely 0, zilch, nada in unrestricted aid. The state should this, the state should this, the state should this. Yes. Well, what support have you given the states? None. I mean, how can that even be? How is it even plausible as a strategy? It doesn't work. We need financial resources to stabilize the states, because when you starve the state governments, I still eat, Dr. Zucker still eats, but we can't fund schools, we can't fund hospitals, we can't fund small business, we can't fund all these extraordinary efforts that we're undertaking. It makes no sense. We need to support the states because the states are the ones who are doing this. Reopening is up to the states, right? That's the federal decree. It's up to the governors. The governors will decide. The states have to decide. Everyone is in a different position, and it's up to the states, which I agree. It also happens to be the Constitution. But put that aside. I also think it's the right approach. Okay, it's up to the states, but then don't ask the states, don't give them this massive undertaking that has never been done before, and then not give them any resources to do it. That's not how this is going to work. The expression, don't pass the buck without passing the bucks. A.J. Parkinson, Mark remembers him. Don't ask the states to do this. It's up to the governors, up to the governors, up to the governors. Okay, is there any funding so I can do these things that you want us to do? No. That is passing the buck without passing the bucks. Passing the buck, which is the opposite of the buck stops here. The buck doesn't stop here. I'm passing the buck, and I'm not passing the bucks. I'm not giving the financial assistance to actually perform the responsibility. So, last point is we go from today to tomorrow. But we talk about the new normal. This also has to be an opportunity where after this horrendous period that we have gone through on every level, after the exorbitant cost of this, the personal pain of this, the death of this, this has to be one of those moments in time when we look back where we say society transformed. It was a learning and growth and transformational period where growth and evolution was accelerated. Yes, society took a terrible blow, but it became a moment of reflection where all sorts of new reforms and innovations happened. That's what we have to do with this period when they look back at it. So our goal is not, let's get up and turn the machine back on and keep going the way we were. No. How do you make the changes now that you've been talking about in some cases for years, by the way, but you never had the political will to do it, or it was too hard, or it was too difficult, We talk about environmental changes that we're going to make, but we never really do it. We talk about issues of income inequality, but we never really get there. You know, we talk about changes to our public transit system, but it's too hard, it's too controversial. All right, well now you have an opportunity in this window to really make changes and reforms and improve things in a way you haven't. And by the way, if you went through this, and you went through this pain and aggravation and suffering, and you didn't learn, well, then shame on us. Then shame on us, because there are so many lessons to learn. And then you come back better than you were. 9/11, New York took a terrible beating. This nation took a terrible beating. We learned from it. We grew, we're better. 9/11 transformed the country. If I told you before 9/11 you were going to take off your shoes when you went to an airport before you could get on an airplane, and they were going to go through every bag and you would say, I'm never doing that. 9/11 said this is a different world. Look at all the security measures we now have post 9/11 that we would have never envisioned. We went through Hurricane Sandy. We didn't build back what was. You build back better than before. You take that moment, you learn that lesson, and you improve society. We have to do that here. And we have to do it affirmatively. It doesn't just happen. You have to say, we paused, New York pause. You paused. You reflect, you learn, you grow, and you move forward. Look at what we learned about the public health system. You know what we learned about the public health system? There is no public health system capacity. Hospitals had the number of beds they needed to operate. Well, what in case of an emergency? There was no emergency capacity in hospitals. Nobody had beds left empty. Oh, that wing is in case there's an emergency. Then we would use that wing. It didn't exist. Why not? Well, that's not what we did. So, how do you improve the public health system? How do you improve the emergency response? Well, we never had to deal with a pandemic before. By the way, what is a pandemic? Okay, well, now we did. And now let's learn. And how are we going to be ready for the next situation like this? Because there will be another. I don't know what it is. I don't know when it is. I don't know if this virus comes back in a second wave. But there will be something. And we have to be ready and better for it. And not just what you learned, but what have we been talking about doing that we should be doing that this is now an opportunity to do? We've been talking about reimagining the workforce and workplace. Does everybody actually have to drive into the office every day? Or did we learn that there are ways to telecommute and work from home where it's actually more efficient, it's actually more effective? What do we do about a transit system? And how do we make it safer? Not just the way we've been talking about, but also from a public health point of view. And how are we now smarter about public interactions? I can't tell you how many doctors now have come to me and said, you know, I said for years we shouldn't be shaking hands, that it's just a total way to transmit germs and viruses, et cetera. So how do we take this moment, since we are paused anyway, and actually come back smarter? I also believe it'll work. It's a moment of personal reflection, you know. We've been in a different circumstance. We've been in a different circumstance vis-a-vis our family. What have we learned during this heartbreak and during this crisis? I've spent a lot of time with my kids, 22, 25, twins, two 25s. My interactions with my kids had gotten so superficial over these past few years. You know, everyone's busy, busy, busy. So what do you need? Everything good? You need anything from me? When do I see you? I miss you. That was the same conversation, like over and over and over. Now I got time to sit with them and really have in-depth conversations that I hadn't had in a long time. And I'll tell you, one of the things I learned is I was missing a lot. You know, they're not 4, 5, 6, 7, 10 years old anymore. They're grown up, and they have complex lives and complex feelings and complex situations, and you don't understand that or get to appreciate that when all you say is, how's everything, anything you need, when do I see you again? You know, well, I was busy. It's my defense to myself. I was busy. Yeah, except that's not an excuse. And take a deeper reflection on what's important in life. And you can't have a real quality relationship with your child or another human being unless you take the time to get below that surface and really understand the person and really take the time to talk through what's going on. People don't work that way. They don't open up in a 4-minute conversation. So now I wind up in a situation where I have a couple of hours to talk to one of my daughters. And there's a whole person and life and nuance that's going on that, frankly, I had been oblivious to. I'm not going to let that happen again. I haven't been able to see my mother. She's a little older, and I see a lot of people. I'm exposed to a lot of people. I don't want to go see my mother because she's in a vulnerable population, and I'm out and about a lot. So it would be careless to go see her now. But I think about all the times I have said to her, she lives in Manhattan, she said, can you come over for a cup of coffee today? How many times I've said, yes, I'll come over for a cup of coffee, and then called back and said, I can't do it today. Next time. Why? Well, because something came up, I was busy, I didn't have the time. Wrong. That was more important than anything else. Sometimes you don't miss something until it's been taken away. And it made me rethink what was important and what I had been missing. And I'd been missing a lot because all this, we're all busy. Yeah, what does it mean at the end of the day? You know, what were you really busy with, and did it matter? So I know that I've learned a lot on a personal level. But we may be more physically distant for the foreseeable future. The key is to be more connected individually, more connected as a society, more connected as a community. And that's what we're going to do.